So today I want to talk about elbows. I've been getting a lot of people asking questions about how to manage lateral elbow pain at home. A lot of us are spending a lot more time on the computer, maybe not moving around as much, or maybe there's just some stuff that's kind of lingering that is just now not going away. So what can we do? It's a couple of really simple things. Traditionally, this lateral elbow pain has been considered lateral epicondylitis or even tennis elbow. Now, most people don't seem to play that much tennis anymore. I mean, there certainly is that subgroup, but most people that have this get diagnosed with tennis elbow and they go, I don't play tennis. Well, thing is, this muscle group for these wrist extensors, fingers extensors, all come up and attach out here. Also, if we're really busy and using our arms a lot, sometimes we can just get overloaded here. And sometimes this is even a little bit of referral where something funky is going on in the neck and there's a little bit of nerve entrapment down here at that lateral elbow. Also, all these things can lead to symptoms. That nerve entrapment, again, some of this funky neck stuff, if we're spending a lot more time at the computer, some of this postural stuff can start to overload here, work its way down. We're in the middle of this quarantine. A lot more people are working from home, laptops, etc. Not awesome. So let's talk about a couple of things real quick, and hopefully we can give you guys some relief. So the first thing we want to do is kind of treat the area locally with some sort of mobility ball. I really like the lacrosse ball just because it's cheap and easy to find, and it's got a good tacky surface that allows us to do some good stuff on the tissue here. So what I'd like you to do, and if you have a mobility ball in general, anything will really work. But we want to take this and we want to see if we can use it to get that superficial tissue. And you can see I'm moving that ball up and down and things are moving pretty far away. And what I want to make sure is sometimes in areas of inflammation, the different layers of tissue stick together. So if we take that ball and even just kind of move it around anywhere around this area, if there's a super hot spot, like stay off of that, but just kind of take it and see if you can move it around that area. And again, we're kind of tacking that superficial tissue and sliding. We can also tack and then spin it. And if you can see that, it's kind of winding up that tissue as I spin it back and forth. Kind of move all the way around. And yes, I know this looks weird, especially right back here, but hey, whatever. So just move it around and let's make sure all those layers are sliding. If we want, we can even put that tissue on a little additional stretch as we wind that tissue up and try to get those superficial layers gliding. So I'd spend about a minute or two there. Next thing we want to do, let's just kind of assume that there's probably something coming from the neck, because there usually is in these cases. That being said, an area that gets super tight for people that's really safe to work on is this kind of like upper rib, upper trap kind of area that almost everybody, if you've ever put your hands on somebody's shoulders and squeezed it a little bit, everyone just goes, oh, keep pressing there. So I can show you how to do this on your own. We take that ball and we place it kind of between our neck and our shoulder blade, and we're going to lie back down on the ground. You can do this against the wall, but I like it on the ground because just let gravity do the work. I'm going to take my opposite hand, make a fist, just kind of rest my head on it, and take that arm up in the air, and I'm going to bring it up and overhead, elbow straight, arm down towards the ground. I'm just going to let gravity do the work here. As it presses into there, my arm down, the more weight gets transferred onto that ball. So now that ball is pressing up into those ribs and all that soft tissue around there. And I can just bring that thing up, pause for a second, and bring it back down. Bring it up. If it's not quite tender enough or it doesn't feel therapeutic enough, kind of move it around. That feels a little bit easier. Maybe I'll move it down a little bit. So anywhere down, again, between that shoulder blade and the spine, shoulder blade and the neck. And we're just going to move that around. And I'd say spend about 1 to 2 minutes there on each side. Never hurts to work the opposite side as well, just to make sure there's some balance. Third thing we want to do, so let's say now maybe we've taken a little bit of pressure off some of the neck stuff with this. Maybe we've taken a little pressure off the tissue specifically here. We're going to try to load this tissue very easily. So the first thing we'll do is we'll hold that arm out straight and take that opposite hand. And what I'm going to do is just press down here, but I'm just going to perform an isometric, which means a muscle activation without any movement. So I'm just going to press the back of my hand into my other hand. So the back of my left hand is going up into my right hand. I'm just going to hold for about 30 seconds, maybe 45 seconds. Pretend that it's been that long and relax. I can do that with the arm straight. I can also do it with the arm bent because it changes the pull just a little bit. I try like 2 to 3 of those on each side. This is a time-intensive part of the exercise because what we want to do is if those tendons and tissues are irritated, they don't like to be loaded, meaning you grab for something, you grip something, you get pain. That just means that those muscles are kind of going like, oh, I don't really want to be used. So we're going to use them lightly, even encounter a little bit of pain, hold, and then leave it there for, like I said, 30 to 45 seconds. Hopefully, it'll over time and days and weeks, it'll start to rebuild that tissue's tension tolerance a little bit, and those symptoms should come down. The last part that we want to take care of is that nerve mobility. So we got nerves that are coming out of the side of the neck. They run through a ton of tissue, and there's all these places for it to get caught and snagged on, all the way down to the arm, and then it wraps up and around here and down the back of the arm is that radial nerve. Some other ones that go down as well, but for right now, we're just going to focus on this. And what we want to think about is that nerve mobility wants to slide through tissues. Nerves and nervous tissue they don't like pressure. So I don't want to take it and put tension across both ends of it, but it wants to slide from one end to the other. Kind of think about like a piece of dental floss. So we call it flossing. So what we're going to try to do is we're going to start, and if we want to think that it starts here and it ends here, because it does, if I lengthen on one end, I want to shorten on the other, and then if I shorten on one end, I want to lengthen on the other. So the way to really wind this nerve up is I can tension my neck this way, and I'm going to slack my elbow. So my right ear is going to go towards my shoulder, and I'm going to bring that palm up like I'm trying to touch my same side shoulder with it. That's going to lengthen through here, and then I'm going to look over that left side, and now I'm going to take my left hand down and kind of pull the fingers up behind me. So it kind of looks like this. So I'm going to dip my right head away and try to touch my shoulder with my left hand. And then I'm going to look my head over the same side that I'm going for. And then I'm going to take that left elbow straight and kind of pull my fingers back, which I should feel a little stretch. And all we're going to do is we're going to do that 10 to 20 times. Again, radial nerve flossing. So what I'd like you to try is try a little bit of soft tissue here, a little bit of local soft tissue here, some isometrics, and then some of that nerve flossing, and see if that helps. As a physical therapist, of course, we're always trying to get our hands on people and really assess what else is going on. Again, if there's an underlying neck problem, which there usually is, there's an underlying shoulder problem, which there usually is, a lot of the tissues and the joints around here can be involved. So it's nice to kind of selectively go through, assess what's going on. Maybe your clavicle's funky, and that's totally a thing, I promise. So if we can go through and really see where some of the stuff is coming from, it helps us pick apart where it's coming from and how to selectively fix it. That's what we would do in the clinic, but these exercises are some of the base things that we would do to get people started. So start there. If you have any other issues, you can always reach out to our team. We're here for in-person consultations and also telehealth, where we can reach all across California. Thanks.